This is the interpreter doing an audio check. 1, 2, 3.
Hi, everybody. I'm Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. Thanks for joining us today on Facebook Live. We've got a couple of people here to give you an update on vaccinations in Johnson County this week. And we are also going to take some of the questions that we are seeing on Facebook, either previously or as this event is going. We won't be able to answer all of them, but we're going to do our best to answer the ones that we're seeing over and over. And at the end, we'll make sure you know where to get more information. I'd like to introduce Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is Director of Epidemiology, and they will be answering your questions. Thank you also to Allison, our interpreter, and Teresa Freed for helping us put this together. So I'm going to go ahead and just ask a question I think a lot of people are asking to start with, and either one of you can answer all these. What is the plan for vaccinations this week in Johnson County? Who can get vaccinated and who is doing those vaccination clinics?
Thank you, Jody. I'll start off. Of course, my colleague, Elizabeth Olshuk, will always jump in to add additional clarifications. So we are actually vaccinating fairly broadly this week. Just to remind people that we are in phase 2, which is a very large group. And so we are focused on tier 1 right now. In the tier 1, we have our 65 plus, we have K through 12, we have child care, we have emergency services, which is police, fire, sheriff, and then we have the food and agriculture sector. So we started in the 65 plus last week. Within that very big group, we started with the 80 plus, those who are at least 80 years old. Now, that does not mean that you don't qualify as a 65 plus, but because we only have limited vaccines, we have to make decisions based on data, based on our assessment of the risk. And that's what we did. We have had questions about why are you focusing strictly on the 80 plus? As we've said, be patient with us. You do qualify, and that's why we are working with our partners in the county. Beginning this week, partners including Advent Health, Oleta Health, KU Med, are assisting in vaccinating in the 65 plus category. That's ongoing this week. There's also the part of the K through 12 that Elizabeth will talk about. That vaccination is starting this week also for our educators in that category. Also this week, beginning today, we started vaccinating in the emergency services category. So as you will see, we are simultaneously vaccinating in 3 to 4 of those categories in tier 1. Again, key thing to keep in mind, your interest in getting vaccinated is really good. We love it. We're just asking that you exercise patience with us as we move through that. The reason why we are working with partners is to be able to get to you as quickly as we can. Every vaccine that we have received in the county, we have given them out as quickly as we can. We have given what we have received every week out that week. And that's what we are going to aim to continue to do. So we have been in conversation with our hospital systems for several weeks, and they understand that for this to be more effective, it cannot just go through Department of Health and Environment alone. And so they do this routinely. That's where you get your flu shots. And so again, because we just don't have enough vaccine, within their system, they are making decisions as to who they reach out to. So keep a couple of things to keep in mind. Don't reach out to them until they reach out to you. They have their database that they are working off of. And the other question that we've gotten is, I haven't, I've submitted or completed the online form. If you haven't heard from us, again, be patient. We are working through our list. Last week, our focus was on 80 plus. We will still need to focus part of our efforts next week on the 80 plus. But beginning from next week, we are also going to be opening clinics that are targeting parts of that 65 plus. So that's one thing to keep in mind. The second piece is I've had questions of, I am not in those, I'm not a patient of those hospitals. Where will I get vaccinated? Well, if you're not, we will be opening clinics where you can get vaccinated. And Jody, I might be jumping to some of your questions, but since you asked, I just want to make sure that people know that there are multiple things going on simultaneously this week. We are vaccinating in the 65 plus age group through our other providers, our partners in provision of vaccines, our health systems. We are going to be vaccinating in the K through 12, and Elizabeth will jump in and kind of clarify that. We are vaccinating in the emergency services, our law enforcement area this week. We are also giving out second doses for those that are due this week. So even though you've not been called, please understand that there are several activities going on. And as we walk through the thousands of people that have expressed interest, we just ask for your patience. We'll get to you. You don't need to call us. You get the information from us if you have registered. You definitely don't need to register 10, 20, 30 times, not even 2 times. Registered only once. We are going to get to you. You want the vaccine. We want you to have the vaccine. Elizabeth, do you want to talk about the educators briefly for this week?
Absolutely. So as Dr. Ariola said, we've been partnering very closely with our hospital partners, and Children's Mercy is that hospital partner that we have partnered with to immunize all of our childcare providers as well as our school staff. So this week we are focusing predominantly on our special education staff. And really, again, as Dr. Ariola spoke about, we're really looking at data to drive these decisions. And what we've seen in our classrooms is that our special education teachers and those students tend to have to be quarantined quite a bit because of the inability for some of the students to mask and mask well. And so in order to sort of create a bit of a bubble around these classrooms, around these vulnerable students, we're going to move forward and immunize our SPED teachers first, and that's going to be through Children's Mercy. And really the way we're doing this is working with our 6 school districts for this first round, and then starting next week, we'll move into our private and parochial schools as well as our childcare providers. So if you are a teacher in Johnson County working for one of the Johnson County schools, please reach out to your administration to find out additional information. If you live in Johnson County but work in a different jurisdiction, a different state, a different county, I would recommend that you go ahead and reach out to your administration at your own school or even the county you work in, and they may have opportunities for you to be vaccinated. But at this stage right now, in this very moment, with our limited supplies, we are focusing on going through our school districts and our public and private schools here.
I'm seeing a lot of specific questions about specific healthcare systems. For instance, people are saying that Advent Health doesn't have any doses yet. They don't have any appointments. People are asking about St. Luke's. So when people have specific questions about a specific healthcare system, what is the best way for them to get that information?
The best way to get the information is, and I hesitate to say this, is through the health systems, but we also don't want the health systems to be overwhelmed with calls. Really, the best line of action is to wait to be contacted by these health systems. They have plans in place. You mentioned Advent Health. I do know that although they have not publicly made the announcement of what's going on this week, the plan is there, and they will be making those announcements in the next couple of days. They have the vaccines. They will start giving out the vaccines this week. But again, keep in mind, you're one of several tens of thousands of people that qualify. So there's no need to overwhelm their system by calls, just like ours. Just wait for them to communicate with you. They will provide the information to you on how to register. St. Luke's that you mentioned, we're working with them. We have limited vaccines, so not everybody was able to get vaccines this week. And we're still working through some logistics with a few of them. But as soon as those logistics are worked out, we will make sure they have vaccines. So if you are a patient of these health systems, just patiently wait. And if for whatever reason you are not, you still have the opportunity to get the vaccine through the Department of Health and Environment clinics that are upcoming. The idea is one channel is not as good as 7-8 channels to distribute the vaccine. We're working with even other providers so that we can make this vaccine available through multiple channels in the county. Again, if vaccine is available, then we'll have more providers and you have more ways of getting the vaccine into your arms.
Yeah, I think that answers a question I just saw. Someone was asking, why not just do mass vaccination clinics? Why use health systems as partners? So I think that was a good answer to that question I just saw. So do we have any kind of an idea on timing of when JCDHE might be doing clinics for 65 plus not affiliated with healthcare systems? Is it in the coming week? Do we have any kind of an idea?
Yeah, we are working on our plans for next week. We have been very, very careful to not make plans to not definitively say this is what we're going to do until we have vaccines in our hands. It looks promising that we are going to get at least the dose that we've been getting, about 6,825 this week. And so if we get that like Wednesday, Thursday, we'll be announcing plans for next week. But your question is, are we having plans to complete those 80 plus that have not been vaccinated yet? Yes, yet next week? Yes. Are we making plans to vaccinate in the 65 plus? Yes. But again, keep in mind that second doses are due. So we're going to be balancing, giving out the second doses, the thousands of people that need the second dose with the 80 plus, with the rest of the 65 plus. And that's why it's very important what our partners, our other vaccination partners are doing to assist in vaccination in the county. But yes, we will plan to do that next week and the week after. Again, the limiting factor is always vaccine and our responsibility to give the second doses. And the question about mass vaccination clinic, we have been doing that. There's just so much you can do with mass vaccination clinic. We have done a lot. We've given out close to 1,800 a day. We've seen drive-thrus in other places that lasted several hours that were only able to do about 1,100. So that's not going to be enough for a population of 600,000 people. We need to attack this through multiple ways, multiple channels. And that's why partnership and collaboration is there. That's why we don't just call it the local health department. We work as a local public health system, and our hospitals are part of that health system. Children's Mercy is part of that health system. Health Partnership is part of that health system because they are also planning to vaccinate in these groups also. So it's not just Department of Health and Environment, it is the total public health system collectively addressing this and ensuring that we vaccinate our residents as quickly as possible.
Somebody wanted to know, why are we not vaccinating healthcare workers with their second dose of Pfizer this week? We have been vaccinating people that are due their second doses. And Elizabeth, please jump in as I go. We have been doing that. If you might not have gotten an appointment, maybe because of the appointment filled up. But the key thing to keep in mind is you have up until 42 days after your first dose to be vaccinated. I know that we have received similar complaints, and we are working on opening up additional slots for people to get vaccinated for their second doses this week. So sometimes it's a function of balancing
the number of people that are coming in for first doses and the second dose. Your second dose, though, is here. There's absolutely no need to be concerned about it not being here. It also doesn't have to be on the exact 21-day or 28-day. Again, you have 42 days after the first dose to get vaccinated. Elizabeth, anything to add?
Yeah, absolutely. I'll jump in a little bit. So this week we were focusing on second doses for Moderna. We had a number of healthcare associated workers and EMTs and emergency medical services that were due for the Moderna doses. Our first round of second doses for Pfizer is not until the 5th, which is this coming Friday. And in order to be efficient with our vaccine clinics and our doses, we will be doing Pfizer second doses next week. So if you are due for your second Pfizer dose, if you're a healthcare associated worker and you got your first dose through us, you will be receiving an email this week with a link to sign up for your second dose as well.
And that's a very important distinction. So the first set of people that took Pfizer doses from us are not due until Friday. And so again, the focus this week is Moderna second doses, and we're doing a lot of first doses to our emergency services and others. So next week is when the Pfizer is coming. It doesn't have to be exact. You have up until 42 days after the first dose to get it. You will have opportunities to get it next week. Like Elizabeth said, the information will be sent out later this week. We have your email or phone number. You'll get information on how to register to book one of those appointment slots.
So just to summarize that, so people who need their second dose when it's time, they don't have to contact you. You will reach out to them and give them what they need in order to make that appointment.
That is accurate. You don't have to contact us. We'll reach out to you. The dose is here because we've had questions about people concerned about the availability of the dose. We have your second dose. We have your second dose. You do not have to contact us. We'll reach out to you. And we may need to spread them out again because of the sheer volume of what we're having to do, the number of groups that we're having to vaccinate. But we do have your second dose. We will reach out to you. You'll have an opportunity to come and get your second dose.
And real quick, just going back to questions about hospitals. There was a question, why are other hospitals like Menorah and Overland Park Regional not included in your partnership? And I believe they are, and there's going to be information coming out about them.
Yes, they have. I'm sorry, Jody. They are. We have been meeting with all of our hospitals for several weeks. I sit in that meeting. Elizabeth does as other members of our team. They have been very, very collaborative. They have been very, very willing to be a part of this, and they're working through a few things. Also, the part of it is the availability of vaccine. But if you are a patient of those hospital systems, you will be able to get vaccines through them. Again, given that they have thousands of patients, if you don't receive email from them, it's not because you are not in the system, or it's not because they are not giving out vaccines. It's because there's just so much that they can do given what they have. They don't have vaccines from us for this week, but we expect them to get vaccine very soon, and they'll begin to reach out to you.
Okay. For someone who is 80 or older, or knows somebody who is 80 or older, and they've taken the interest survey, but they have not made an appointment yet, when can they expect to hear from Johnson County about setting up an appointment?
Yeah, I will start. Elizabeth will come in. We have spent a lot of time the past few days talking through that. And I'm glad you asked the question, because I've also had a few emails about the statement that I made last week about the 80 plus. So I would like to clarify that. Okay, so if you are 80 plus and you have completed the form, you do not have to do anything. We'll reach out to you. I have had emails from people saying that they've completed it several times and that they've called different health systems and registered multiple times. You do not have to do this. One time is what we need. Completion of this multiple times does not increase your chances of getting the vaccination. we are very deliberately, like Elizabeth said, systematically going through using data. The reason why we focus on the 80 plus is because they are more vulnerable. It's not saying that 70 to 79 are not vulnerable, but the 80 plus are more vulnerable. Our data supports that. And it's also just a way for us to be able to go through the limited doses of vaccine that we have and find a way to move through the population that are interested. So it's not suggesting that you are not as important. You are. You getting vaccinated is as important to us. And yes, you are in phase 2, and yes, you are in phase 2 tier 1. But even that's a very large group. We're just working through that as best as we can based on the number of vaccines that we have. Now, if you've completed that, what we'll do when we have vaccine is reach out to you and say, hey, we have this many appointments, book an appointment. Now, if you don't have access to the internet, you can call our number, and I'm sure that Jody, you'll display the number, and we have people that will assist you in completing those numbers. However, the question is, if you are registered in our system, whether online or through the phone system, you don't need to do anything, just wait for us. Again, we have walked through a lot of the 80 plus. What we did week before last was look at everyone that was registered with us and was 80 plus. And we sent an email to them asking them to book an appointment, and they filled most of the appointment that we had last week. Of course, we did some second doses and we did some healthcare workers. That was it. And then later during the week, we were getting more and we're trying our best to fit those in. But since then, thousands others have completed that online survey. Elizabeth and her team are working through, and I'm going to tell her to talk through that process. They're working through those numbers. And just roughly, we're estimating that we have maybe a couple of thousand more in that category. And Elizabeth, you can correct my numbers. And those people, we're going to target them at our next clinics, hopefully next week, to knock that out. But again, vaccination in the 65 plus category is ongoing in the county. It is not just through our clinics. Our partners, the health systems, are vaccinating in that group. And we are going to continue to fill in the gaps, hold our clinics, vaccinate as many as we can, and that's what's going on. So Elizabeth, will you talk about the data? And you have more people. We have some people that are registering like 40 something times. You don't need to do that. Can you just explain where we are with that?
Yeah, absolutely. So when everybody fills out their survey online, that comes to us. And what we have right now is a spreadsheet with about 150,000 responses from the survey since the beginning. But due to some server issues or maybe just some confusion, not all of those are completed. And then also, as Dr. Ariola mentioned, there are a number of people who have filled them out 5, 10, 40 times. And so it falls on the epidemiology team to really go through that and make sure that we have one record per person and that we have an email address or a phone number that we're able to reach back out to you. So as we're continuing to refine this list right now, it does appear as though we maybe have 4,000 or so additional individuals who have registered in that 80 plus age group since the week that we pulled that data to offer up those first round of appointments. So I know a number of you listening, or your friends and family maybe have reached out and filled out that form and you're confused because you haven't heard back from us and you didn't get an appointment last week. We know and we have your information. And as soon as we identify when those clinics are going to be, we will reach out. We encourage you all to continue to listen to these Facebook Lives, to tune in, to sign up for our daily newsletter. And all of those are going to be opportunities for you to know that we are starting to set up our clinics, what age groups, and then we will communicate back with you if you have filled out that survey.
And so to be clear, if you are 80 plus, have a mom or dad or aunt or uncle that's 80 plus, please do not confuse my statement to mean that we're completely finished in that category. No, we are continuing to vaccinate in that category until we vaccinate everyone. And as more people register, we are going to be pulling out their names and creating opportunities for appointment so we can vaccinate them. And we do plan to do that beginning next week also.
We got another question. So what if if their doctor is not affiliated with one of these healthcare systems, and they might have thousands of patients that need to be vaccinated? What's the plan for that group?
So the simple plan for that is, if you are not affiliated with any of the health systems, you will get your vaccination through the Department of Health and Environment's clinic. And so again, if you are, the first thing is complete the online interest form so that we have your contact information. And as we move through the list, we'll reach out to you. You don't need to complete that multiple times. You don't need to call us to see whether you are on the list. If you complete the online survey, at the end of the survey, you get confirmation that you've completed that. And I think we've done, Elizabeth can jump in also, we've done some reaching back out to you to ensure that you know that we've received your form, your complete application. If you've done that, that's all you need to do. Now, when you hear from us and we provide information about appointments for vaccination, that's where your next action comes, which is you book an appointment and follow the instructions and come in to be vaccinated. But the interest form, you only need to do that one time.
I'll also jump in and add that team is continuing to work with other partners. Dr. Ariel has spoken about our public health system and how that includes our hospital partners, but we have a bunch of excellent partners in this community. Grocery stores, our big box stores that oftentimes will administer vaccines for flu and other vaccines. And we're continuing to work with them to provide those vaccines to these partners to allow it to be a convenient option for you. But again, the number of doses, the number of vaccines that we're getting in is just very limited at this time. And oftentimes, we don't know how many doses we're getting until the end of the week for the following week. So we're continuing to explore various avenues because we know that, people are really looking forward to getting this vaccine. It's definitely the light at the end of the tunnel. And we're going to try and do what we can to ensure that everybody has that access, whether it's through us, through their hospital partner or hospital system, or through another partner.
What is your plan to reach homebound seniors? And then I would add to that, maybe people that don't have internet access, that aren't watching this Facebook Live. How do we reach out to those individuals?
We are compiling a list of people that are homebound and people that need additional support to either complete the application. We are looking at options to work with partners in the community to ensure that they get help to not only complete interest form, but also be able to get appointments to vaccinate. There's a lot of work going on there. And the basic point is there's quite a few people without access to the internet, and that's a limitation of the vaccination efforts. But also as we try to boost our resources, again, it's a pandemic, it's a massive operation that it's demanding on existing resource. But as we're working with the county manager and several other departments to boost our resource, we are going to be adding additional ways of reaching people. Some people, we might need to take the vaccines to them. Elizabeth was talking about other partners. I think right now I'm hesitating to be more specific until things are worked out, but we're working with partners that have mobile units, for example, that will allow us to go to some places. Once we get more vaccines and some of the logistics are worked out, then we'll make those, be more specific about those efforts that are ongoing. As she said, also, we are working with multiple partners, area agency on aging and others with relationships to these people, to parts of our population. We're just going to have to attack this in multiple ways. When we talk about equity, that's really what you are talking about is right now, if you don't have internet access, If you can't drive yourself or have somebody to drive you, you are at a disadvantage. And we recognize that. And equity is a big lens through which we look at everything we do. And we're looking at opportunities to bridge that gap. If you're working 9 to 5, which is when we have our clinics open, it might be difficult for you to get out of work to come. We're looking at all of those options and seeing how we can make this accessible to everyone.
That's a nice transition into another question that I'm seeing. You talked about we're looking at mobile units. People are suggesting things like FEMA, the National Guard, a drive-through clinic. I would imagine that we are investigating multiple options. I don't know if you had any comments on any of those suggestions that we're seeing.
Yeah, at least the 3 that you mentioned are things that we're looking at. We have looked at exploring all the options. Every option is on the table. For us, it's about throughput. It's about getting vaccines into the arms of as many people as possible. And it's about exploring multiple ways of vaccinating people. So all of the options have been looked at. We continue to look at them. And I suspect some of those that you mentioned, we will do some form of it or another. But again, understand that vaccination is going on across the entire county, across the state, and across the region. And it's a massive operation that's really bigger than what the local health department can do alone. So we do need, we have been using volunteers and exploring the use of more. We're getting help from other Johnson County departments and from the county manager's office. And we're exploring different things. That's what's going to take for us to do this and to do this as quickly as we can. Again, I do want to emphasize that thus far, every vaccine that we have received in a week, we have given them out in that week. So there's no vaccine sitting anywhere. So the question, of course, is relevant when we start to get a lot of doses. And based on our relationships with existing providers that we've been working with, we feel pretty confident that we can continue to give the vaccines out as we receive them. Our partners have capacity. We have increased capacity that we are working on expanding. So between us and our health system and the other providers that we are working with, we can distribute many more vaccine in a week. That we feel very confident that we can do that.
You were speaking about adding resources in different areas, and we have a question about wanting an update on the addition of outsourced contractors that are going to be assisting with call center efforts. What is an update on that plan?
Elizabeth, you take that.
Yeah, absolutely. Yeah, so we have a group of contractors that have come in today to begin their training. They'll go through a couple of days of training and then start taking calls in with oversight of our existing call center staff. And really the hope for these individuals is to focus on this vaccine rollout. We know that the number of calls are just astronomical, and we know that people are frustrated. And so we're hopeful that this first piece of additional capacity, and probably the first piece of many as we try to expand and ensure that we're providing the excellent customer service that we should be here in Johnson County. And so that is beginning today. We are shuffling around management to ensure that there is a strong leader over them, to ensure that we are able to meet the needs of the community.
We feel pretty, of course, we have been, with the help of the county manager and other departments, we have been doing our best to return all of your calls and get back to you as quickly as we can. But we are getting hundreds of calls every day. And so this capacity is a starting point. It would help us, at least not to fall behind. Your calls and emails are absolutely important to us. we want to answer your questions. If you have questions, whether you are on the list, we want to be able to tell you. If you have questions about what our plans are tomorrow, we want to be able to tell you. If you have questions about when you should expect clinics to open, we want you to know that. So that's absolutely why we are here, to work for you. We're working on that. I believe that based on what Elizabeth said, you should begin to see improvement in us picking up your calls and returning your calls early in the next couple of days. Again, very, very appreciative of your patience.
Yeah, and really more thousands of calls. I think there were a number of days last week where we probably had over 2,000 calls. And when you think about the fact that before the vaccine rollout, our team was managing only a few hundred a day, this has been a really tremendous increase for the existing staff. And so again, really excellent partners in other county departments. Our group has been picking up a lot of those phone calls that they can answer, and keeping our staff who have a little bit more in-depth knowledge to be able to answer some of those more detailed questions. And so we're also working on some tech changes, some technological changes too, which will hopefully increase our ability to get back to you, for you to leave a message. So hopefully in the next week or so, you'll start seeing some changes in terms of our ability to reach back out.
I think that sounds great. I know there is an effort happening here in the county to not only with the phone calls, but with the emails, doing more of these Facebook Live events where we're answering questions from the public, also doing more media, news conferences. And I just want to reiterate the ways that the public can stay involved. Obviously, our Facebook, Twitter, and other accounts, the health department, social media accounts are another great opportunity of getting information. Our website, jocogov.org, a lot of good information there that's being updated daily. I would encourage you, if you're not on the distribution list yet, to sign up for our e-newsletter. And you can go to jocogov.org/COVID newsletter, and we send that out 5 days a week to your email inbox. So we will continue to reach out, and you've got just the COVID hotline number for those who might not have that, 913-715-2819. So I think we will wrap that up for today, and just watch for notification that we're doing more of these. Thank you so much to everyone on this call and everybody watching, and we will talk to you soon.
Thank you.
Thank you.